perk of plastic surgery. Their motto is, because it's how you feel that counts. And she's joining us to talk about some of these facial rejuvenation treatments. And my mom, if she is watching, I can tell that she's probably up in front of the TV because she's been talking about this kind of stuff. And last time we talked about topical things that you can do, but let's go a little bit more in depth, if you will, and talk about what you can do for your face as far as, you know, some procedures are concerned, and specifically a facelift.
Sure. So what we talked about last time was a lot of the surface of the skin issues, the skin cells on the top layer, things that are affected by sun and smoking and generalized aging. Now, the thing we didn't get a chance to address was the deeper structures of the face, that we lose collagen and elasticity in the deeper structures of the face. So,
part of living and getting older.
Gravity
no wonderful thing.
So things that we can do to address that. So for this, more surgical options are needed.
Okay, so let's talk about a facelift. If you want to try to focus on this area, this is one that my mom would love to try to get back a little bit, the neck and the jowls. You say a facelift is typically is a good way to go to get the results that you want.
Yes, it is. And my facelift population is anyone over 40. I'm starting to see patients a little younger and younger who want to really address the lower part of the face, the jowls and neck.
And the thing of it is, and I know some people are really concerned about the scars or anything that may be as a result, but you use a very special technique that you can't even see the scar.
The facelift technique I do, my favorite procedure, I do it in the office with local anesthesia, just light sedation. It's a minimal scar facelift, but gets just as good results as I used to get with the full-on long scar operating room kind of facelift.
And so you can be in and out and within one day.
You're in and out of the office that same day. It's still a surgery, so you know it's not a go to lunch afterwards.
Right. You still have to be conscientious.
Need a good 2 weeks of downtime of where it's going to look like you had something done. So you've got to hide out for about 2 weeks.
Well, here's my favorite part. I like looking at the before and after because you know that way you can really see what the dramatic difference is between what you had before and then when you get the facelift or what have you, the difference. And this is the first patient here.
The first patient here, I kind of cropped the rest of her face so that you could really focus on the area that we're addressing, which is that lower part of the face and neck.
Wow.
The jowls, in the aging process, the face tends to become more square.
Yeah, you can see that, and that is on the left-hand side of your screen.
And so what we're trying to do is restore that youthful oval shape to the face, and that's what this procedure does.
Wow, and you can really tell a difference between that. And is this the same procedure than you did for this?
Same procedure, different angle, just to look at especially if you focus in on the jawline, you'll see where the improvement happens.
Yeah. And then I think we have a couple more just to show you. And this is the one my mom calls the turkey neck. And no offense to this lovely lady here, but you know, when you have the little skin that's under, you want to get rid of that. And this is one way you can do so.
So yeah, she had the most dramatic improvement on the neck.
Yeah, I can tell.
Kind of shows just a different angle. Another patient, same procedure. Back to work in about a week if they don't mind looking like something happened, but 2 weeks is
and something you can do over the holidays too, because chances are you're going to be away from work for a week or two, and if you're so fortunate, you know, and then you can have that procedure done. What about around the eyes too? Because this is one thing that actually my dad brought up to me, and because you know when you get older, you have the skin that's above, you know, the eyes below the brow that just kind of starts to sag a little.
For this, this procedure here is an upper blepharoplasty, which is just an excision of the excess skin of the eyelid and some fat removal of that protruding fat that causes those sad, tired eyes. So very rejuvenating. It takes an hour to do the procedure. You know, about a week to 2 weeks of downtime with this one too.
That picture that we just saw, I mean, it was just a noticeable difference. It didn't even look like the same person. I mean, she has such beautiful big blue eyes in the bottom, and you couldn't even really see them because, you know, and a lot of people say, though, that makes you look tired, and you're not tired. You know, my mom's, it is, and my mom, you know, will say, here I go, I'm throwing her out there again, but, you know, her face is starting to sag, and people are like, oh, you need to smile, and she's like, I can't smile, it's the way my face is, you know, I'm just getting older. So there are things that you can do to help remedy that. Thank you so much, Dr. Kirk. I always appreciate you coming on.